Let's start with something many of us know all too well: high blood pressure. So if you're over 60, chances are your doctor has mentioned it at least once. In fact, more than half of older adults live with hypertension. And it's not just a number on a chart. It's one of the biggest risk factors for heart disease, stroke, and kidney problems. Maybe you've had the experience of sitting in the doctor's office, waiting for that blood pressure cuff to deflate, hoping that the numbers come back a little bit lower than last time. Or maybe you take medication and you wonder if there are ways to reduce your dependence on all of those pills. High blood pressure is often called the silent killer because you can feel fine, yet it's working quietly in the background, straining your heart and your blood vessels. So the big question is, aside from medicine, diet, and exercise, what else can we do to keep our blood pressure in check? The answer, my friends, may surprise you. It's spending more time in the forest. Now, before you picture yourself hauling a bathtub into the woods, let me explain. Forest bathing is a translation of the Japanese term Shinrin-yoku, which simply means to take in the forest atmosphere. It's not swimming or working up a sweat. It's about slowing down, using all of your senses, and being truly present in nature. Think of it as quality time with the natural world, like visiting a close friend who you always know will calm you down. You're not rushing. You're not checking your phone. You're not checking your watch. You're breathing slowly, walking slowly, noticing the light through the trees, the song of the birds, the smell of the fresh earth. And here's the exciting part. Scientists are finding that this super simple, gentle practice has measurable effects on health. It doesn't just feel nice. It can literally lower blood pressure, reduce stress hormones, and improve your mood. Let me tell you about a study that looked at exactly this. It just came out this year. Older adults with hypertension spending 3 days in a forest. Researchers in China wanted to test whether a short forest retreat could help older adults with high blood pressure. They gathered 36 participants, all between the ages of 60 and 80, all living with hypertension. And they divided them into 2 different groups. One group went to spend 3 days and 2 nights in a subtropical forest. The other group stayed in the city for about the same amount of time. Both groups had the same meals, the same schedules, and similar activities. The only difference between the 2 of them was the setting, was the forest group versus the city group. And in the forest, participants did gentle activities like slow and mindful walks. They had a tea ceremony, gentle movement exercises, and quiet meditation under the trees. So I bet you're asking, what happened? It was really, really remarkable. But let's get back to the science of it. Blood pressure dropped. In the forest group, both the top number, so your systolic, and the bottom number, your diastolic, went down noticeably compared to the group that was in the city. That's not it. There's still more. Inflammation decreased. The forest group had lower levels of something known as hsCRP, and it's a marker that's linked to inflammation in heart disease. There's still more. Stress and mood improved. Participants reported feeling less anxious and more energized. So remember, this was just 3 days. No new medications, no intense workouts, no grand interventions, just time spent in a forest environment. So how does being in a forest have such an impact on blood pressure? Well, scientists believe it's a combination of natural factors, including fresh and clean air, because trees release natural compounds known as cytonicides. You know it, you love it if you've been on the channel before. And these cytonicides can lower the stress hormones that we have in our bodies and can boost our immune system. Also, the sounds of nature. Birds, wind, and running water quiet our nervous system, lowering tension. We can also talk about green scenery. Looking at trees and plants has been shown to calm the mind and reduce our stress. Continuing on, we can talk about gentle movement, like walking slowly and stretching lightly supports circulation without overexertion. Continuing on, we can talk about disconnection from stressors. Away from screens, away from traffic, and all of that consistent noise, the body has a chance to reset. All of these combine to lower stress hormones like cortisol, reduce inflammation in the body, and support the heart and blood vessels in such incredible ways. For older adults, this means an accessible way to manage hypertension. One that doesn't require gyms, treadmills, or heavy weights, no memberships, just trees, and time, and your senses. Now, maybe you're thinking, that sounds great, but I don't live near a big forest. Well, good news! You don't need to. Forest bathing is less about the specific forest and more about how you interact with whatever natural space you have nearby. So here are some simple ways to get started. Take a 20-minute walk in your local park without your phone. Move slowly and notice what's around you. Sit on a bench or under a tree and just breathe deeply, paying attention to the sounds and the scents. If mobility is a challenge, sit by a window with a view of trees or plants. Research shows even looking at greenery can help reduce stress. Bring natural elements indoors like houseplants, flowers, or even nature sounds played softly in the background. And if you'd like guidance, look for a local forest bathing walk led by a trained practitioner, like me. These guided experiences can help you get the most out of the practice, especially when you're first getting started. Let's get back to the bigger picture of this study. This study, my friends, isn't the one and only. Around the world, more and more research shows that time in nature helps lower our blood pressure, it helps reduce our stress, and it improves our overall health. For older adults especially, forest bathing offers something quite unique. It's gentle and it's low impact. It supports both physical health and emotional well-being. And it's enjoyable and often social if it's done with others. Doctors are beginning to call this kind of practice a nature prescription. Imagine leaving your doctor's office with advice that says, spend 30 minutes in the park 3 times a week. It's a simple, accessible, and cost-effective way to support your health. So here's the takeaway. Hypertension is serious, but managing it doesn't always have to mean more medication or complicated programs. Sometimes the answer can be as simple as spending time with the trees. Forest bathing isn't about exercise or performance. It's about connection. It's about slowing down and breathing deeply and letting the natural world restore your body and your mind. So the next time that you feel stressed out or the next time that you're thinking about your blood pressure, consider this: a walk in the woods, a little sit under a tree, or even just gazing at the greenery outside your window might be one of the best things that you can do for your health. Your next step forward to a healthier heart may be as simple as stepping into the forest. So before I sign off, my friends, remember I love you and all of that kind of stuff, but I want you to go talk to your doctor about the impacts of spending more time in natural spaces and what they think that would do for your health. Thank you guys so much for watching me today. I've got a bonus resource for you if you would like to know more about how you can lower your blood pressure using forest and nature therapy. You can find all of those links down below. Until I see you again, remember, I love you, be excellent to each other, and I'll see you in the forest.